Depression is a serious problem. It affects millions of people around the world. In fact, it is one of the leading causes of disability. This makes it a major global health concern. In the United States alone, nearly 1 in 10 adults struggle with depression. That's a lot of people. Depression is a mental illness. This means it affects the way we think, feel, and act. Unlike a physical injury, you can't always see it. This can make it hard for people to understand. It is important to remember that depression is real and treatable. Many people feel sad sometimes. This is normal. It could be because of a bad day, an argument, or even the weather. These feelings are temporary. They usually go away after a short time. Clinical depression is different. It is a medical condition with specific symptoms. These symptoms last for at least 2 weeks and affect daily life. It makes it hard to work, enjoy hobbies, or connect with others. Doctors use specific guidelines to diagnose depression. A person must have at least 5 symptoms from a list. These symptoms must be present most of the day, nearly every day, for at least 2 weeks. One key symptom is a persistent low mood. This means feeling sad, empty, or hopeless most of the time. Another symptom is losing interest in things you used to enjoy. Hobbies, socializing, or even favorite foods become unappealing. Appetite and sleep patterns often change. Some people eat more and gain weight. Others lose their appetite and lose weight. Sleep can be disturbed. You might sleep too much or have trouble falling or staying asleep. Depression also affects thoughts and feelings. You might experience worthlessness or excessive guilt. Concentration becomes difficult. Simple decisions feel overwhelming. Some people feel restless and agitated. Others have low energy and move slowly. Depression isn't just in your head. It causes real physical changes in the brain. Scientists have found that certain areas of the brain are smaller in people with depression. These areas are involved in mood, thinking, and memory. One of these areas is called the hippocampus. It plays a role in learning and memory. Another important area is the frontal lobe. This part of the brain helps us make decisions, control impulses, and plan for the future. Brain chemicals called neurotransmitters are also affected. These chemicals carry messages between brain cells. In depression, the balance of these chemicals is disrupted. This can affect mood, sleep, appetite, and energy levels. Scientists are still learning about all the factors that contribute to depression. It is likely a combination of genes and environment. This means that some people might be more vulnerable to developing depression due to their genes. Life experiences such as trauma, stress, or loss can also play a role. Now, there is good news. Depression is treatable. With the right help, people can and do recover. Effective treatments include medication and therapy. These treatments often work best in combination. Medications for depression work by balancing brain chemicals. They can help improve mood, sleep, and appetite. Therapy helps people understand and manage their thoughts, feelings, and behaviors. It provides coping skills and strategies to deal with challenges. In some cases, other treatments might be recommended. For example, electroconvulsive therapy, ECT, can be helpful for severe depression. This treatment involves sending small electrical currents to the brain. Transcranial magnetic stimulation, TMS, is another option. It uses magnetic pulses to stimulate brain activity. It's important to support those struggling with depression. Encourage them to seek professional help. Offer to assist them in finding a therapist or making a list of questions for their doctor. Remember to be patient and understanding. Recovery takes time. Most importantly, let's talk openly about mental health. By breaking the stigma, we can encourage more people to seek help. Remember, depression is a medical condition, not a weakness. With support and treatment, recovery is possible.